Stu, I want you to tell me about your hip. I know you had your hip replaced on June the 11th, so that would have been like 2 months ago. Tell me a little bit about your experience, good, bad, and otherwise.
Actually, the entire procedure, from getting to the hospital to ultimately leaving the hospital, was almost a walk in the park. It was a terrific experience, both the preoperative one, of course, it was in the preoperative holding area, and of course, once they gave me the pre-op medication in the holding area, I remember absolutely nothing at all that happened until I woke up later that night. Zero, nothing. But...
Well, now wait a minute, before you go any further.
Yes.
Tell me about that night when you woke up.
I woke up and I was fine. I can say that I literally had no pain from the time I woke up till today. I never had pain. I was up and around that first day. The second day I was up walking in the hall with a walker and with the physical therapy. I went to the joint camp to go through whatever they wanted me to go through. And I was home on the second day. And that was it. I was up walking the rest of the time. I had no physical therapy other than walking. Again, never had any pain at all.
Tell me about when you first got up. Were you scared?
No, I was not scared at all. I do this, so I was not at all scared. Actually, you know what the only problem was? That they would not let me sleep the first night.
Wouldn't let you sleep, baby.
If they would just quit coming in every 2 hours and waking me up, I would have been great. But I know the routine.
And that kind of reminds me, people who are looking at this are wondering why two guys wearing scrubs are sitting here talking. The reason you're wearing scrubs is because, tell me what you do.
I am a general and vascular surgeon here in Hendersonville, have been for 30 years and 8 years in Miami before that. So I've been doing this for a while. I knew what to expect. I had my hip done here because I had full confidence in you and I had full confidence in Pardee Hospital. I work here, I've been here for 30 years. I have total confidence in what we do here. So,
now, how many surgical procedures have you performed, just out of curiosity?
Thousands. Thousands of surgical procedures of all kinds.
I'm just going to guess that I know I've done 6,000 joint replacements, and I know if I've done 6,000 joint replacements, you've probably done 20,000 procedures.
I've probably done over 20,000 colonoscopies alone. So, in addition to taking out gallbladders and fixing aneurysms and carotids and all that, I've done somewhere in the neighborhood of 25,000 colonoscopies.
So tell me about your average day. What do you do in an average day?
Average day, get up at 6, eventually come in here and start my surgery. Either surgery here or I go to my office and do my office work there, seeing patients, getting ready for them to have surgery. And then I'll come here and do more surgery. I make rounds up on the floor, but I'm on my feet most of the time.
You're on your feet most of the time, and when you do a surgery, what's a typical case for you?
I would say the most common case would be taking out a gallbladder or fixing a hernia. Usually takes about an hour, sometimes an hour and a half of being on my feet the entire time. Same thing, even the colonoscopy, which usually takes 15 to 20 minutes, I'm on my feet the entire time. And after this surgery, literally within 3 weeks, I was back to work full-time, doing all of the things I do.
Now, I don't want the folks out there to think that that's what happens to everybody.
I thought that was typical. I had no idea.
That's not typical.
I expected it to be that way. But
what was that like your first day back at work? I will never forget your first day back. So I walk into the lounge and you've got this look on your face like, uh-oh, he caught me.
Well, I probably didn't do everything exactly the way you wanted me to do it after surgery.
Why does this not surprise me?
But I was quite literally walking 2 miles on my second week, much to the chagrin of my wife, and you didn't know, thankfully, but I was walking 2 miles within 2 weeks. I was carrying my cane with me, just in case. I was not using my cane, but I had it with me.
And that first day back at 3 weeks after your surgery, do you recall what cases you were doing? I'm sure you don't.
Probably a gallbladder, probably a hernia, something like that. I'm sure a colonoscopy.
Colonoscopy. Do you have to get in weird positions to do a colonoscopy?
Yes, sometimes you do. Sometimes it's a lot. You got to put a lot of body English on it sometimes.
Was that an issue that first day back?
I've had no issues with my hip whatsoever.
So
Nothing. I mean, I've had no pain at all. From the day of surgery till today, zero pain.
I got to say that's a little weird, but it's great. It's great. What kind of advice would you give someone who's out there who's probably a little scared, who's got pain in their groin, who has put up with this for like 2, 3, 4 years, and has treated themselves conservatively, and is getting ready to go what you went through, and they're scared?
Well, I treated myself conservatively with lots of Advil and Aleve and aspirin, whatever I took, and a lot of limping around. But eventually, of course, it gets to the point where it's bone on bone, and I knew that. But from my experience, I'd say get it done today. You know, the great thing is that we've got replacement parts, whether it's for a knee or for a hip or for a shoulder or whatever it is.
For an aneurysm?
For aneurysms. We have a lot of replacement parts. And, you know, I know that you've been doing this for a long time. I knew what approach I wanted, which was the approach you do, the anterior approach. You know, I'd looked into this. I mean, you know, I don't go into these things blindly. And I knew we had a great hospital. I know you've been doing this forever. So I had full confidence in going ahead with it. And I would tell anybody else, rather than suffer the way I did for a while before I finally gave in and walk around with bone on bone, get it done.
So you're now about, let's see, 2 months out from the surgery. Just for fun, let's get up out of these chairs, and can we I want you to do the impossible. I want you to pretend like nobody's looking at you. We both know there's a camera
I understand.
out there.
Yes, okay.
But let me just see you just walk across the room.
Okay.
Come on back.
That's it.
All right, that's good. That's good. Now take your pants down and show us your stomach. I'm kidding you, Steve.
I'd love to do that too.
I'm kidding you.
Great.
Thank you.
Thank you.
Appreciate you.
Really, I think, and honestly, that's the way it was.
See you, man. Thank
Bye-bye.
you.